Hello, I'm Dan Leonard, President of the National Pharmaceutical Council. The NPC recently commissioned a study looking at the overall health impacts on businesses as they consider the overall costs of managing their employees' health. The study looked in depth within 10 large employers and over 50,000 individual employee respondents and over 1.1 million medical and pharmacy claims. The study was recently published in the Journal of Occupational and Environmental Medicine, and it's one of the most thorough studies of its kind. It's also available for review on our website, www.npcnow.org. To discuss and expand on the findings of our study, I'm pleased to be joined today by the primary author of the study, Dr. Ron Loeppke, Executive Vice President of Health and Productivity Strategy for Alere and the Chair of the Integrated Benefits Institute, and Dr. Pamela Hymel, Corporate Medical Director at Cisco Systems, one of the 10 participating companies in the study, and also the incoming president of the American College of Occupational and Environmental Medicine. Thank you both for joining us today.
Be here.
First question, Ron, for you is the key finding of the study is that productivity costs are far greater than simply the calculating the medical and pharmacy costs alone. That factors of absenteeism and presenteeism make this a much bigger issue. Could you explain how those factors were considered and what that meant to the baseline of the study?
Yes, thank you. The reality is there are broader implications to poor health, the full cost of poor health to employers that haven't been fully recognized in the past. So on the converse, there is a new business value to health for employers, and that's including the health-related productivity impacts of poor health, presenteeism and absenteeism. Presenteeism is when a worker is present at work but not as productive because of a health condition or health risk. And of course, absenteeism, they're away from work because of those problems. And in this study, what we found is that overall, across all 10 employers, on average, for every $1 of medical pharmacy expense, they're spending $2.3 in health-related productivity costs.
So that's a significant factor, $2.30 basically for every dollar of the hard costs of medical and pharmacy.
That's right.
And it's interesting to note that the conditions change significantly. When the conditions are at the top of the list in cash outlays of medical and pharmacy are eclipsed by different conditions when you're factoring in presenteeism and absenteeism.
That's right, Dan. When you look at medical pharmacy costs alone, we found that the top 5 conditions are cancer, back and neck pain, other chronic pain, depression, and coronary heart disease. But when you add in these health-related productivity loss, the top 5 drivers of those conditions change in nature and scope. The top driver being depression, secondly, obesity, third, arthritis, fourth, back and neck pain, and fifth, anxiety. So the implications are employers need to pay attention to not only those chronic conditions that have historically shown up by looking at the radar of medical and pharmacy claims. They need to look at the sonar on this iceberg of health-related productivity costs and include these other conditions and risks.
So the overt conditions that everybody's familiar with and they've been paying through the medical and pharmacy, but now looking deeper into some of these more hidden or more subtle conditions that are affecting.
Right.
And Pam, from your position at Cisco, first of all, you were a participant in the study.
Right.
Has this changed the way you're conducting business at Cisco, or you've changed benefit design at all, or implemented any wellness or prevention programs?
It has. It's greatly changed our business strategy. We actually have a fully integrated health enhancement program now. We're giving employees incentives for participating not only in a health assessment with a presenteeism questionnaire, but also to participate in health coaching, disease management or condition management, working with health advisors, because we know that by getting employees to focus in on some of these conditions that cause the presenteeism, we'll be able to make them more productive both at home and at work.
And are you seeing this, as a question for both of you actually, are you seeing this across other industries, other companies that either participated in the study or otherwise that are making changes in the way they work with their employees?
Yes, I know as I participate in a number of business coalitions, more and more employers at the table are talking about adding these types of programs. And even in some of the recent studies that have been done, looking at benefits across employers, one of the key focuses for them is in the health promotion and disease prevention area.
And how about within an individual company, within that workforce? Did you see differentiation between management and labor, or blue collar, white collar?
That's a great question, Dan. And in fact, historically, a lot of people have said presenteeism, absenteeism doesn't really impact managers and executives because they'll do the work when they can, at night, weekends, whenever, they'll get the job done. But what we found as an interesting finding is that executives and managers actually do that extra work, so they don't have any absenteeism. In fact, they probably work overtime, but they do suffer from significant presenteeism. They end up being many times burnt out because of this long work hours and pressure. And we found a significant higher prevalence rate of depression, anxiety disorders, gastroesophageal reflux disease, and a presenteeism impact on executives and managers. I think in general, given the climate that we have in our economy today, and in the strain on the workforces that we have today, that in fact stress may be one of the most toxic environmental exposures that we face as a society.
Well, clearly Cisco gets it and is making some internal reform, but it takes attention at the highest levels. So the C-suite, the executives, the management of a company needs to see the value in programs such as this. Are you seeing this start to spread throughout the country? Attention at the C-suite level?
We are. We're actually seeing, I think even in the healthcare reform area, the whole focus on prevention in some of the initiatives points to that. But there are a number of other large companies, Dow Chemical, JP Morgan Chase, IBM, that all have award-winning integrated programs supported by their senior-most management that are implementing these kind of programs and showing results from them.
In many instances, in fact, one case study where we worked with a CFO to translate this value proposition beyond just ROI and net savings of medical pharmacy costs into the broader value proposition, what I call the VOI, the value of the investment that includes these productivity savings. And in that instance, they had 58,000 employees. The modeled impact on productivity loss was $153 million a year. On average, 8 days of lost productivity per employee per year. They said if we could just get back 1 day per employee of that lost productivity, it would be worth to them $18.5 million in their EBITDA, bottom line. And for them to get that same impact on EBITDA by growing top line revenue, they'd have to grow that by $76 million. And so the CFO took this to the C-suite, and we presented, and he translated it into shareholder value, said that for the $18.5 million on EBITDA impact we could get by getting 1 day back per employee on lost productivity, they traded a 13 multiple in Wall Street. That's around $240 million of increased market cap value improvement. And they had 282 million shares outstanding, so that was about 80 cents per share. So
by getting 1 day back.
By getting 1 day, and so C-suite is really focused on this. It is a new day where they're looking at the value of health and the benefits of health and seeing that as an investment to leverage rather than just looking at the health benefit as a cost to justify.
And that's the calculation that needs to be done in more C-suites around the country for them to really, to get senior management to pay attention.
That's right.
You really need to demonstrate it that way. Thank you very much, both of you. This is clearly an issue that is getting legs, has some momentum behind it. It's a very busy time in health reform in general, everybody knows that, but we will be following this and working to advance these topics further. And I, again, would reference folks to the study, Health and Productivity as a Business Strategy, a Multi-Employer Study, which was recently published in the Journal of Occupational Environmental Medicine. And thank you very much for watching.
Thank you.
Thank you, Dan.